everybody. I'm Traci Baird, and I have the pleasure of moderating this session about gender inequality and COVID. I am going to briefly introduce myself and our panelists, who I hope will pop up on the screen behind us, and then we are going to get started. Hi everybody. I guess I waved to you this way, but I see you this way. Wonderful. So I'm Traci Baird. I'm president and CEO of EngenderHealth, and we work globally on sexual and reproductive health and rights programs towards the goal, ultimately, of gender equality. And during the pandemic, my kids encouraged me to adopt a pandemic puppy, and when I started going back to the office part-time, we needed to get a pandemic kitten to keep the puppy company. So all is well. On the panel with me today, we have Latanya Mapp Frett, who's here. Wave, Latanya. Latanya is president and CEO of the Global Fund for Women, one of the world's leading foundations for gender justice, connecting resources among a diverse group of partners, more than 5,000 groups across 175 countries and growing, to create meaningful change that will last beyond our lifetimes. During the pandemic, Latanya took on a book project, writing about the 15 cities where she's lived and the ordinary women she's met doing extraordinary things. Helga, do we have Helga on? Hi, wonderful. Helga Fogstad is the executive director of the Partnership for Maternal, Neonatal, and Child Health. We call that PMNCH for short, which is a multi-constituency global partnership that advocates for comprehensive, high-quality healthcare, working toward accountability for resources and results. Here on the stage with me, we have Lisa Kolovich. Lisa is a special advisor to the IMF Senior Advisor on Gender Equality. An economist by training, Lisa focuses her research on gender budgeting and fiscal policies as tools for reducing gender inequality. During the pandemic, Lisa's daughter convinced her to adopt 2 puppies. And Shirley, I'm going to give a wave. Dr. Shirley Sylvester is Senior Medical Director for Women's Health with the Office of the Chief Medical Officer at Johnson & Johnson. Her women's health team develops and implements programs and partners with external stakeholders that support the overall aims of women's health. During the pandemic, Shirley adopted Sunshine, a rescue hound shepherd dog, has spent a lot of time cuddling with her 3 small children, and has baked endless batches of cookies and cakes. So you can tell we have all been busy growing the love around us during these pandemic times. We hope there have been silver linings for you too. And we do have longer bios for all of our wonderful panelists online in the program, so I hope you'll learn more about each of us. So why are we talking about gender inequality during the pandemic? We got a bit of a tip-off to this during the last panel. Magda Roballo talked very eloquently about the fact that 70% of the global health workforce is female, and we know the impact of COVID on healthcare providers has been enormous. I'll add on to that by mentioning that 30% of the global health leadership in the world is female. So the disparities continue not only in the workforce, but that workforce pipeline flips its balance when we get to leadership in global health. And when we think specifically about leadership on COVID, what's your guess for the percentage of global COVID task force members, national task forces for COVID all over the world? What percent would you guess is female? About 25%. A little better than 2. I saw a guess of 2 in the room. I don't blame you. We could have been going there. It's about 25%. So women have been incredibly impacted by the pandemic and have not had a full share of the leadership space in addressing and solving the pandemic. You wouldn't know it looking at this panel, but here we are, and this is our reality. And as others have said in their opening plenary, these inequities long preceded COVID, and the pandemic has, in a sense, exacerbated what was there. And these inequities are not only about gender, but also about race and economic status, ability or disability status, and so many other factors. So today we are going to talk about gender and COVID. And what we decided to do was to have each panelist respond to a few different prompts Then we'll take some questions from our in-person audience and our virtual audience, and hopefully have time to give everyone on the panel a chance at her last word. So we're going to start, and I'm going to invite each panelist to talk a little bit about the impact of the pandemic on women and on gender inequality. How were women disproportionately affected? And as we think about women, let's also think about young women and youth in general. How have young people been disproportionately affected? Shirley, we're going to start with you for this one.
Thank you, Traci. And I thank you so much for the invitation to you and to all the organizers of this important event. Just as you mentioned, I'm part of the Health of Women team, which is part of the Office of the Chief Medical Officer within Johnson & Johnson. And our team is really dedicated to advance women-centric science. And let me start by saying that the pandemic has highlighted the importance of really understand the differential impact not only in sex but also in gender when it comes to multiple diseases. But here we are still in the COVID-19 pandemic, and there is still a lot that we haven't yet fully understood between the two of them, between the two sexes and the two genders. Early on in the pandemic, we have heard a ton about the excess mortality that we observe in men, and that it's certainly true. It is true also the fact that epidemiologically, men tend to die at a faster rate than women. So this is when we associate sex and gender, we have to look at the whole picture, not just looking at one of them, because it murks the waters. So, what we did in our space when the pandemic hit is really deepening our understanding of this variation and the differential impact of these two variables. And we have been able to conduct various studies in which we have uncovered important insights. In one of our studies, for example, it's a large review that we did in a meta-analysis, and what we realized at the end, just to be precise, is that we missed the mark when it came to long COVID. So we were obviously, and for good reasons, very focused on the acute dynamic of the pandemic, on the mortality being, you remember seeing the highlights in the newspapers, in every article that you saw on the news about men dying at a higher rate for COVID. What we missed is the long-term complications and the chronic complications that women experience as a result of COVID. And what we're left behind as a society is a society that has been infected. Imagine the astronomical number of people who have been affected by COVID, and of women who have been impacted by COVID, developing long-term COVID, which leads to severe disability and comorbidities. And long COVID is a disease that is a condition that is difficult to diagnose, difficult to treat, and it has that pattern that as a society we really tend to really associate with women whining. It's the chronic fatigue, is the endless tiredness that people feel to fulfill their normal daily lives. And so therefore it's much later to diagnose them, it's much later to treat them, and have really severe impact. What we have also seen, let's not forget pregnant women, adolescent pregnant women, and people in the postpartum period. So we also have conducted some studies in that population in several countries, and what we realized to really understand what was the impact in health-seeking behavior. And what we uncovered is that health-seeking behavior remained constant. The access, obviously, to healthcare was very disrupted, as we all know, and we probably have been affected by it. But we realized that in the pregnant population, the astronomical impact of mental health disorders, depression, anxiety, loneliness, stress, that has impacted this population tremendously, and that is underneath that pandemic, is the hidden epidemic of mental health disorders that we're left with as well. And the last, just to round my perception of this, is that there is also and locally for us, we have access to preventative solutions. We have access to vaccines right now. But when vaccines were approved initially, there was obviously a lot of mistrust, and there's still a lot of mistrust when it comes to vaccine, and especially in the pregnant population. That first they were not included in the trials for different reasons, but then therefore they don't know how to understand what it is the data about vaccine safety and efficacy in that population. So even though the vaccine acceptability tends to be high in pregnant women, the actual implementation of the vaccine has been so impacted by this mistrust, and we see pregnant women dying of COVID-19, even though we know that the solution is right at our fingertips.
Thank you, and we've heard a little preview earlier today about the disparate uptake of vaccination among women, and if in some countries only a quarter or fewer of vaccinated people are women, then we're going to see that carry over even more when you're talking about pregnancy and the postpartum period. So thinking about the impact on women and children. I want to shift to Lisa and invite you, Lisa, to talk a little bit about how you've seen from your perspective women being disproportionately affected.
Absolutely. So, as a researcher at the IMF, we look primarily at how women are impacted at a macroeconomic level. And so we've looked at a wide array of areas. Let me just offer a few. We've looked at unpaid work. So we know that before the pandemic, women often bore the burden of unpaid work. They did on average globally about 3 hours more of unpaid work per day than men. And as we've all mentioned here, the pandemic has just exacerbated that burden, right? So we've seen women having to take care of their children when daycare centers closed, having to educate their children at home, taking care of sick elderly relatives, but then simultaneously trying to balance the demands of their jobs. And we all know how difficult that can be. We've done studies at the IMF to show the impact of just redistributing unpaid work. That can have an impact, a macroeconomic impact of about 4% of GDP. So it's crucial that we think about how to address these unpaid work burdens going forward. Other areas that we looked at gender-based violence, which is something that has really risen during the pandemic. It's been an issue before, but we saw studies have shown from Nigeria, for example, there was an increase in the first few weeks of the pandemic of a 56% increase in the reports of gender-based violence, right? So a huge impact right when the pandemic started. And we had a study come out recently at the fund that showed that for every 1 percentage point increase in reports of gender-based violence, that leads to an 8% reduction in economic activity. So these have just, again, huge macroeconomic consequences. And then we can also think too about access to education, right? So of course, during the pandemic, we were forced to switch to remote learning if we were lucky enough to have access to remote learning. Many countries certainly did not have this type of access. And so we've seen girls drop out of school at higher rates than boys, which will of course have lasting consequences for countries, right? The girls themselves, the families themselves, but then also too thinking about long-term development goals. How do we achieve economic growth? How do we achieve sustainable, inclusive, resilient economic growth when girls have not been given an opportunity to have education? And one more area that I'll highlight too in terms of the disproportionate impact has been in terms of the sectors that women are working in. So it's already been mentioned that women are overrepresented in the healthcare sector. They're overrepresented in the tourism sector, in face-to-face, in sectors that require face-to-face interaction, right? So many women just simply were not able to telework. And the countries that I work on, I was in the African department before my current position, and we were working obviously with low-income and developing countries. And in this case here, many women too are in the informal sector, right? So when the pandemic hit, not only were they often, the first to lose their jobs, but they weren't able to access many of the formal social safety net services that are available. So things like unemployment insurance or other services that might help prevent the impact from losing your job, the poverty impacts that come along with that. So across the board, just huge consequences for women. And of course, this just translates into very large macroeconomic consequences for countries as a whole.
So personal health, community health, global health, economic consequences, education, and we are just getting started. Latanya, Let's hear from you and what you've seen in the work with the Global Fund in terms of the impact of the pandemic on women and young people.
Yeah, thank you so much. And thanks for the invitation to the organizers. I wish I could be there in person with you. It's been a long time, Traci, since we've seen each other. It's interesting because we talk about the impact, but only as far as we know, right? I mean, there's so much more that we haven't really been able to dig into. Our colleague just mentioned the informal sector. It was interesting to see the reaction, when the UN report came out showing that 29% of working age mothers living with their children lost their jobs compared to 20%. Because those of us that know these communities around the world very well know that that didn't account for almost, the entire informal sector, as just was mentioned. And so we know it's so much higher and the implications are so much greater than we know. And we're going to, in fact, have to, as advocates, press to try to get the kind of information that we need in order to be able to actually take advantage of and leverage that information for better policies and structures and systems as we go forward, and to make sure that there are what I would say some action that we can get to be able to address some of these needs. And so we know, as was said, that, women typically, not just, during a pandemic, but any crises are going to be disproportionately affected. And, and one of the things that I'm starting to see more research on, but things that we have been hearing, is about mental health, the suicide rates among women and girls, and starting to get some information on what that's looking like, particularly in communities outside of the global north. But we can say that we know that this is going to be an ongoing issue. The instance of women being forced out of the workplace hasn't stopped. With the various variants that have come through, we saw more and more challenges to this structure, even in situations where women were initially provided some support to be able to stay home, some support to get actual cash outlays to be able to support their families. And the reason why this is just so hugely important, as of course, as all of us know, and I know I'm talking to the choir here, but that when women do not have the ability, particularly in the informal sector, to be able to feed their families every night, there is coupling and multiplying effect on both the families and the communities. And so all of the work that we've been doing over the last few decades to get to, we mentioned education, but girls' education, we were at a point where girls' education was really reaching a point where we were, as a global community, quite proud of where we were landing. And now we're starting to see, I saw some initial reports, as you probably did at the World Bank, about LECs, so the least developed countries and some other fragile countries that even were not on that list, where we're seeing numbers coming in now that, the high schools in particular, only 10% of girls are back in school for so many different reasons. But as we know, and as was mentioned about care economy, it's not just women taking care of their children, but it's also, in many cases, adolescent girls taking care of their siblings. And in many places in the world, this is normal, but in this experience of the pandemic, the girls have come back home. They've been home for a year. There's still challenges for the parents, and especially the mother, to get work. And so they're now having to stay home. Not to mention countries where the education systems just haven't started back up again. Uganda is one of those. I was just on with my colleague there talking about formal education. Formal public education has not yet gone back. And of course, that will have rippling effects on adolescent girls. I'm glad my colleague talked about pregnant and birthing women, because we still have a lot of work to do to figure out how that is. We saw, as we know, that the access to reproductive health care and rights has, in many places around the world, has been incredibly thwarted. And in a number of countries, we know that technology has been a huge challenge for many. And I'll talk about that a little bit later as well. But I think overall, I'll just sum it up that, unfortunately, the pandemic has threatened many years of progress towards gender equality generally. And so much of the data that we're going to see around equity and equality and gender justice is going to decline. And we do know that already, whether it's on girls' education, the lost years that we're going to be talking about for girls, particularly adolescent girls, around women's health. My aunt passed in January, not because of anything to do with COVID, but because of the stretched health systems of the U.S. And so now you think about in many other places of the world where the healthcare systems just were so stretched that they couldn't attend to more normal problems in normal time. So we're going to see a little bit more of that. And of course, I'll just end with our challenge around gender-based violence and how that had played out in this pandemic is certainly worthy of all of the sort of interest that we can put towards it by way of resources to make sure that we don't get to this place again. Thank you, Traci.
Thanks, Latanya. Sorry about your aunt. And I think you're right. You mentioned early on in your comments that what we know is only what we know. And we know there's a lot more below the surface on all of these topics. Helga, love to invite your comments and help us know a little bit more of what we do know.
I think it's important to put some figures to some of this, to the situation, because, in a WHO study among 11 countries in Africa, the maternal mortality in facilities has risen with 16%. And this means, and we know that, many of our mothers are actually dying at home. So this is just the tip of the iceberg. And what this indicates is it's erasing a lot of gains that we were able to do in the MDGs. And now all of a sudden, in a very short period, this is erasing and taking us back. And this is really serious because it says something about not only what we need to go forward better, but also something about preparedness and recovery plans. So I think in some ways, just realizing that 45% of facility births, was a reduction in that, and also looking at, the indirect effects of COVID on women and girls was multiple and really serious because they were not able to get services that actually they paid with their lives. And if you see I recall the UNFPA's estimates on the pandemic disruption of contraceptive use were among 12 million women with consequences of nearly 1.4 million unintended pregnancies during the 2020 across 115 low and middle income countries. And then we saw this adding to others of looking at how this affected also adolescents, secondary school girls who were, out of school for 6 months due to COVID lockdown. We saw twice likely to become pregnant. So enormous effect on girls, adolescent girls, and also then women. My colleagues on the panel have talked about the risk of sexual violence due to lockdowns. Enormous effects. So the pandemic caused 1/3 reduction in progress towards ending gender-based violence, and that it resulted in 13 million child marriages taking place otherwise would not have occurred. So enormous results of the indirect effects that are serious, and we need to look. Also looking at the effects of domestic violence, suicides, all of these have increased. So 1 in 7 adolescents age 19 to 70 is estimated to live with a diagnosis of mental disorder globally, increased enormously under the stress of the pandemic. So enormous amount of direct and indirect effects that we need to understand the magnitude of, especially moving forward.
Yeah. Thank you. It's the indirect, the direct, and then there's going to be continuing these knock-on effects, right? We're going to have these echoes of the impact of the pandemic, I think, for years to come, especially with this intersection of health and education. So thank you all for that. We're going to shift a little bit to what the response has been, and so we make sure we have some time for Q&A. We're going to combine that with also talking about the future. So we'll ask each panelist to talk about some of the good news from the response. What's the response been to all of the impact we were just discussing, and highlight where we can, where women and women's groups have been part of the solution and what we need to be doing going forward. I'll mention that EngenderHealth, as a technical assistance provider to a number of governments around the world on their sexual and reproductive health services, we shifted a lot of services we were supporting from clinic-based services to mobile outreach. When communities are in lockdown or it's not safe to have people gathering in the community health center, we took the services, we took the show on the road, the community outreach mobile services, and we're able to recover the original sort of lost ground in providing contraceptive care, for example, over time. So the number of contraceptive clients that the programs were able to support did recover, and people were having access to that care. We also, and I think others may speak to this, we also moved a lot of training support for healthcare providers and support to communities and individuals to digital platforms. And we're really pleased about that. There's enormous potential. And my pride in that work is just shadowed just a little bit by a reminder from a World Health Organization report from their Gender and Rights Advisory Panel that came out in February that noted that we need to make sure that we don't perpetuate inequality in access to those digital platforms, that wealthier and more educated women are, they believe, benefiting more, and therefore we're going to continue to see new types of inequality in terms of access to digital. So we'll always need to be checking ourselves and making sure that as we go forward, our response in the future continues to promote equity at all levels. So we're going to switch up the order a little bit and go over to Latanya. Let's hear a little bit about what you're seeing, Latanya, in terms of the response. And I know especially you've been working with a lot of women's groups who are part of the solution.
Absolutely. It's, when we think about these things, the opportunities that many of us had to be with our families again, especially those of us that are on the road a lot, the opportunities to, bring in animals, as I think all of you have said. We even adopted a rabbit during COVID, but really trying, a lot of folks have had the opportunity to reconnect with nature. And now that I'm back on the road, I'm hearing that across countries. And so that is some of the beauty is, around family. I heard Letitia James, who's the Attorney General in New York yesterday, say that, like everything, whenever there's an issue, women show up and we overachieve. And so some of the things that we've seen and the beauty of really recognizing human rights for women and creating a quality platform, Global Fund for Women, as we fund groups, local movements that are already in play. And so what we saw through many of our partners was this opportunity to pivot, but also maybe to push in ways that maybe they hadn't had the opportunity to do that. And I'll talk just about a couple examples of that, and then how, the future looks. But, in Kenya, some of you may have heard of Akili Dada, which is an empowerment incubator for girls. And the high schools, of course, had to send the girls back home, and it's a large degree of high schools that are boarding schools. They did see, like the rest of us, so much of the challenge around, these girls living in homes where things were not well. And so they started to provide like mental health work to girls. They hadn't done that in the past. They provided therapy online, both virtual and sometimes in person, depending on the case. And then they also stepped up their game, and they started getting to low income families where it wasn't being done by the government, actual tablets. and forging partnerships with the private sector in order to be able to do online learning for girls. But one of the other examples that I have is really around the garment industry. And if any of you have been following that in Asia and the Pacific, Global Fund for Women has been supporting work there. As you know, it's been a bit of a slug to try to get benefits for women who are working in those factories, to get safe working conditions for them. And quite frankly, when the COVID happened and people were sent home and income was lost, those movements in those countries, really specifically in Vietnam, Bangladesh, Cambodia, and India, really started pushing for better circumstances, for better wages, for better conditions. And so we start a constellation of partners really to try to lean in and do this work, because it was a moment when you can lean onto some of these big countries and say to them, we need better working conditions. We need pregnant women to be able to get support, to be able to take off and be able to be paid. And these are changes that we don't talk about much, but that we're going to see for the future, that those conditions are going to be better because there was this opportunity to really lean in, and that actual employers are now understanding what we were saying before about these situations. And so while it's not completely solved, I do see a future where the focus on gender equality and gender equity is going to be much more a part of the way that we think about things. And by the nature of seeing frontline workers, at-home caregivers, and in particular other women who've suffered under the pandemic, we're going to see many more, I hope, policies, structures put in place so that we don't ever get to this point again, and that we can talk about a world that is fair, and one where women really don't have to choose between taking care of themselves and their families and their economic livelihood. So I'll just end there so we can hear from our other colleagues. Thank you.
Thanks, Latanya. And I want to sign up for that future where we don't have to make those kinds of choices, and where our policies are really designed in advance for equity, right? We were hearing earlier from our opening speaker about being able to move at the speed of trust. We also have to design with trust and with compassion for equality, not only for what we need right now, but start to anticipate what we'll need in the future. So thank you for that. Helga, let's talk a little bit, or hear a little bit from you about the response and how women and others are part of the solution, and where we're going, what our future looks like, what we need to learn.
Thank you for that. I think one of the things that we noticed, especially in the review of the pandemic and preparedness plans, if there were any, did not address women, children, or adolescents explicitly. And I think that's something that we really need to learn from. We need to also take that with us when we plan for UHC, that we make sure that it actually delivers for women, children, adolescents, and vulnerable groups. So I think it's something about that being made explicit, both as it relates to the patients, the citizens, but also the health workforce, because 70% is women, and they need to. So PMNCH has developed, together with all of its partners, endorsed as a call for action, and it has 7 asks. And the first one is about ensuring that sexual, reproductive, maternal, newborn, child, and adolescent health, services, supplies, and information, and demand generation, including contraceptive, safe abortion, immunization, safe delivery, stillbirth prevention, and mental health are included and made explicit. I think second is the advancing sexual and reproductive rights and gender equality. Third is quality care, including respectful and dignified care, and effective community engagement, and redress mechanisms. And then fourth is recruitment, training, equal and fair pay, and safe working conditions for healthcare work. We must make that explicit. 5 is social protection, and then 6 is the functional, safe and clean toilets, hand washing facilities and quality portable drinking water. And 7 is prevention of violence against women, children, adolescents through education and protection programs. These are absolutely must be made explicit and clear and included in all, not only recovery plans, but preparedness plans, as well as within the UHC planning of a country.
Thank you. And as I mentioned earlier, we know that only 25% of membership of COVID task force are women around the world. I wonder about the UHC, the Universal Health Coverage plans, the emergency preparedness plans. If we're not seeing that women's needs are being addressed by these plans, maybe one thing we should check is to make sure we have some women involved in developing these plans. Not only women, but let's include women, shall we? And let's not only look at gender and recognize that we need lots of different people represented to make sure that these plans meet the needs of our communities and our populations. Before I invite the next panelist to jump in, just want to invite those of you joining us virtually to find the chat function or the Q&A function and pop any questions in there that you have, and we will be able to see those and also take questions from the room. But Lisa, let me turn to you. The response and the future.
Sure. So I think the immediate response that we saw to the pandemic was governments spending lots and lots of money, trillions of dollars to help address the needs of the pandemic, right? And at the IMF too, we were engaged very heavily with our countries trying to roll out funding as quickly as possible. So within the first few months of the pandemic, we were able to provide rapid financing to about 80 of our member countries. That being said, though, what we'd like to see happening is, at least from my perspective, looking at fiscal policies, thinking about designing well-designed, gender-responsive fiscal policies going forward and the impact that that can have on addressing the needs of the pandemic, but also to looking forward, how can that help with resilient and inclusive growth? So I'll just give a few kind of hard numbers and areas where we think that fiscal policies can have an impact. So we can think about access to childcare, right? So one of the studies that we did looked at providing subsidized childcare to women in the US, lower income women, and designing a targeted plan that way. What we found was that overall, when we did this policy experiment, it increased economic growth by about 0.4% of GDP, by about 0.4% of GDP, and increased overall household income, increased female labor force participation. There were lots of good consequences that came from offering subsidized childcare in the United States. We've also looked at the impact on low-income countries. So we did an experiment for Senegal, thinking about government investing in education and ensuring that girls have equal access to education and reducing gender gaps. And what we found there was a huge macroeconomic impact, right, of almost 9% of GDP, 9 percentage points of GDP. So just, again, huge impacts from reducing these gender gaps. During the pandemic, too, we certainly saw countries think about how do we offer and guarantee parental leave, how do we ensure sick leave is available. And so some countries have stepped up on offering statutory requirements for parental leave, making sure that parents are able to take care of their sick children, their elderly relatives, but enshrining this in the legal structure, which is, again, huge, thinking about going forward, how do we ensure that these types of situations do not occur again. And you touched briefly too on the mobile money, the mobile features that can happen and how that can help ensure equity and equality. And let me give one example from Togo, which, as I mentioned before, in sub-Saharan Africa, many women are in the informal sector. And when jobs are lost, they don't have access to government social safety nets. And in Togo, what they did was they introduced a mobile money program right after the pandemic to offer immediate cash transfers. 65% of the recipients were women, and many of these women were working in the informal sector. So it helped provide kind of an immediate safety net for women who might have lost their jobs or have to take care of families. And so these kinds of programs can be, again, thoughtfully designed with women's needs in mind, and can be done in terms of a global policy response and also to a national policy response when thinking about designing fiscal policies that will help address women's needs.
Great. I think, again, we're seeing so many of these intersections, right? I mean, we've heard before that that economic justice is climate justice, is reproductive justice, is gender justice. We can't tease these things apart. We can learn about each, but we need to affect the entire system. And a lot of the data that you're talking about, Lisa, is showing us the impact of one thing on so many others. So thank you for that. Shirley, would love to hear from you on the response. And I know that's been a big part of your work and your leadership, and what you're seeing in the future.
Yeah, thank you, Traci. And I feel inspired by some of the things that my colleagues actually have said here, because it looks, if all of you are in power, we are seeing a brighter future. Yes. But I want to start with just by highlighting a few things or things that I have noticed about how women organically, and just quoting again Latanya's quote from the New York Attorney General, that women, when there is a crisis, they show up. And we saw here in the United States and in many places around the world, organically and independent efforts of women linking each other to develop masks, to sew masks for people, for healthcare workers. We saw these big efforts for school children. We saw, them supporting the healthcare workforce, supporting nurses, and stepping up when vaccines came up. Stepping up to promote vaccination efforts. And today, actually, I just saw an article or a news article from NPR about women in India, 12,000 women in India actually going out of their way really to motivate women also to get vaccinated. So we are seeing these organic efforts being driven by women as well, and that speaks to the importance of how women really are there when there is a crisis, and we need to actually respond to that. But from a more methodical effort, I would say, indeed, government spending was initially very large. And we also, I think from the sector where I am in today, we did see an increased awareness on spending on maternal health efforts and in spending on reproductive health efforts from the private industry. And I work mostly in the United States right now. We do have several programs outside of the US, but at this point our efforts are more concentrated in the US. And what we saw is that, during the pandemic, it wasn't just the pandemic that we were hurting, from a health crisis, but what we saw in the pandemic and during the heat of the pandemic was a racial crisis here in the U.S. that surfaced, and we have seen a lot of private industry really wanting to coalesce and represent not only, to your point, Traci, about not looking at health separately, but how do we combine these efforts to advance solutions that are holistic? So we have seen large spending on femtech, for example, initiatives and technology initiatives that fund women and women efforts beyond even reproductive health and pregnancy efforts, which is important as we alluded to the mental health crisis that we're living and that women actually are experiencing. So that's important. On the other hand, from my perspective as a large healthcare sector company, we have been, even prior to the pandemic, we have been investing heavily in maternal health equity. And during the pandemic, what we observed was just, obviously the community in itself wanting to be part of the solution as well. And so we have been fostering the collaboration with academic institutions, with community organizations, grassroots, state departments, to really look at solutions more comprehensively and more holistically. And we're advancing solutions that are designed for women and that have women in mind because they have been part of the conversation from the beginning. And that's, in large what we need to do. We have to include women as part of the conversation so these solutions down the road have their interests and their needs in mind. And what I see about the future, I want to go back to how I started this conversation, because I started mostly on a data-driven approach, right? So I started mentioning about the disparities that we have seen, and that if we are not looking for the disparities, we're not going to see them. Mm-hmm. So I also envision a future in which people who are responsible for collecting data, for generating data, that they do report the data in a way that we can really see these differences clearly. When we see the differences clearly, we will have better outcomes for everybody, for men and also for women. But we do have to ensure that this data is reported in a way that we can analyze it that way. And what we also see in this future is that private sector, public sector, community groups, academic groups are working together towards a solution. I spoke about maternal health equity, and I think that in the United States, for example, just as Helga mentioned, as in many other places in the world, maternal mortality has increased during the pandemic, not only because health services were disrupted, but also because sadly pregnant women are disproportionately affected by COVID, and they are still dying from COVID in the United States. So we need to coalesce, we need to work together towards solutions that are gonna impact women comprehensively, and we need to provide solutions that are gonna last beyond a pandemic. I mean, we talk, and you talk a little bit, Traci, about telehealth and digital health, and yes, there has been a lot of efforts in this space, but we don't want to perpetuate the mistakes we have done in the past of excluding people who do not have access to those solutions. So we have to be mindful and balance that. So that has given us a great platform to continue working in these efforts, but we have to have that in mind to ensure that there is equity, not only gender equity, but racial equity, social equity, and so on. And lastly, just being part of a large healthcare company also that invest a lot in development of solutions, it is important that there is a diverse population included in trials, so we can actually understand the nuances and in efficacy and safety of products. That's important because we don't talk enough about it, but that we really ensure that we have the responsibility to include enough women, enough representation of racial diversity in our trials, that we're able to really understand how these solutions work for different people. Thank you.
Thanks, Shirley. I think your point about disaggregating data and being able to see it is such an important one. You made many important points, but that one in particular reminds me just to mention as a resource if people are interested, the initiative called Global Health 5050, which you can find on the website globalhealth5050.org, in partnership has been looking at sex disaggregated, gender disaggregated COVID data, and notices that a number of countries are still not disaggregating data. So we know, for example, that women are lagging in vaccinations, and sometimes in hospitalizations. Men are overachieving in deaths. I'm sorry to say, no one should overachieve there. And then Shirley's mentioned earlier, the women are disproportionately affected by long COVID. But seeing the data on a global level is really challenging if countries aren't disaggregating. As an organization, EngenderHealth is committed to disaggregating data by gender and by age. We don't have the national COVID data for any country. We can't see it, and if you can't see it, it's hard to understand it. So thank you for that. So I'm hoping we have some questions. Any questions come in from virtual room? Okay, virtual folks, bring some questions on, because Riti is watching and is ready to text them to me if we have some. Okay, we'll start with questions in the room, but virtual folks, we aren't ignoring you. You just are being quiet so far. But Riti, please go ahead.
Thank you, all the speakers, such a wonderful, wonderful panel. So while I was listening to all of you, I had this question in mind. Since everything has gone virtual now, and we know that the world can exist virtually pretty clearly now that we're doing this as well, is it possible for some virtual facilities or resources to be created for the mental health of the women who do not have access? And clearly in pandemic, everything was shut down, and maybe they had nobody to talk to or reach out to. So is that something that should be invested in for future, so it's easier and to be at home and just a phone call away, especially for women and adolescent girls who maybe have no one else to speak with?
Interesting question, Riti. I'm thinking too about how that could apply for the world, right? So let's hear who would like a little hand. Anyone would like to talk about how we can do some mental health support? Latanya, why don't you start us off?
Yeah, and because I just wanted to reinforce what, thank you for the question, by the way, but reinforce what I was talking about in Kenya. Doing this even among low income settings was something that, women's organizations around the world were doing. Just being able to have a hotline or a phone call when you're experiencing abuse in the home, even for girls who now were under the unfortunate circumstance of not being able to get back to school even when it opened again. So there were provided a great deal of resources from women's orgs, and I'm talking about organizations that may have been doing something completely different before the pandemic, have now started these opportunities to provide mental counseling, therapy during times of stress. And again, and I think we were all mentioning how women show up and how we overachieve. But how now we're seeing that, in the health of women being reflected, just being overworked, over-challenged by the circumstances. And we're seeing a lot of groups really turning to that kind of care. So we heard from Audre Lorde, self-care is a form of resistance. And so being able to continue to do this work means that we have to take care of ourselves and we have to take care of those that are in the movement with us. And so I think that's truly important. But I also want to say, at same vein, how we use technology and how technology has been being used more, particularly during the pandemic. I think we're also seeing a lot more harassment online. We're also seeing a lot more governments that are actually turning to technology to be able to restrict some civil spaces and conversations that they probably didn't account for when this pandemic started. So while we're seeing this opening in the virtual world, we're also seeing some of that being tightened. And I wanted to make that clear because it's not just China or India. We're seeing that across the world. We're seeing countries in Africa that never would have done that kind of thing starting to, sort of stop those kind of conversations, stop those kind of advocacy efforts and organizing, mobilizing online, and the criticism of even leadership, particularly women leaders in many countries around the world has increased like double. Because now we're all virtual and because people care what they're saying and can get to them faster than they have in the past. So I wanted to say there's opportunities that have opened up, but there also we have to be very careful and look at what is closing down for civil spaces online as well. Thanks.
Great. We do have a question about telehealth, but would anyone else like to respond on mental health before we move on?
Yes, I think it's really important to look at new and innovative ways of not only capturing mental health issues as early as possible, but also in prevention from the various sectors. I think that's really an important issue. I think in some ways that COVID did teach us. I mean, the learning curve definitely increased or was more steeper in functioning virtually, and it did give a lot of savings that inspired us in some way to understand how to actually use digital and virtual much more meaningful. And I fear that we're going to actually go back to going to face where the numbers are much fewer that get connected and or in some way. So I really would like to challenge us all to think about how can we actually, in yet not a digital virtual setting, that everybody is connected, because it isn't. And it are the communities out there that actually you need to get connected in some way so that you support women in their settings. And I think the solutions are at country level. They are a little different from one country to another, from one district to another, for multiple purposes, which I think it requires a collective agreement from us all to actually prioritize resources towards that instead of elsewhere. And so that needs to be done by us all in an agreement of finding solutions that are more community-based and that can look a little different.
Thank you. And there was a question from the virtual room about how we can increase access to underserved populations for telehealth, and I think we actually addressed some of that in this discussion on digital access. It's not a given, right, that the telehealth is going to reach everybody. We have to be intentional about that and watch for the unintended consequences of making decisions that make sense for one thing and not for another. One of the countries where EngenderHealth works, the government did a quick pivot to make sure that they had a COVID information hotline. They took over the phone number from the gender-based violence hotline. And then they decided to reroute the gender-based violence-related calls to the children's violence hotline, who didn't have people trained to address questions about gender-based violence until they were trained. It all caught up. But we have to act, and then we react, and we have to really try to be intentional as we move forward. But I do want us to respond in just briefly, so we have a chance for last words, to a comment that came in from the virtual space, which I think is just feels really important to raise, especially given that we're here in Texas, and so I know this can be a hot button issue for the state. But what have we learned about sexual minorities, queer women, transgender health outcomes of the experience of COVID-19? Has anyone done exemplary research and studies and collected data about this? And I want to acknowledge that I think all of our institutions recognize gender is not binary. The data, when we have disaggregated data, the data tend to be binary, and that's when we can get it disaggregated. But in the experience of our programs, sexual minorities, gender minorities, and other people who are even less represented in numbers and at the table where decisions are being made and policies are being set, are having increased disparities and worse health outcomes. Would anyone else like to add to this in some of the work that we're doing? I wonder, Latanya, if any of the organizations that the Global Fund has been supporting are some of the LGBTQ groups and others that are doing such remarkable and important advocacy.
Yeah, and I had this great opportunity a couple of weeks ago to be on the phone with a number of groups with mainly intersecting identities generally, but also gender nonconforming champions and activists, and really just so amazed at how much work has gone in. I do think, and I know the question was around what kind of research is out there. I feel like there has been, so little, but I think there's been so little around gender in the pandemic generally, and we're still trying to catch up. But definitely in this area, I think we need to do a little more work. As many of you know, at the beginning of the pandemic, both online and offline, we saw a lot of harassment happening in particular countries that we knew there were problems. Again, it's this whole thing of like the pandemic actually opened up, all of the inequities that we have been seeing, so that it was almost like there was a spotlight on them. There was a group though that I did want to mention. They're called Mefali, and it's a movement in Cameroon that kind of was part of the feminist agenda before the pandemic, but that broke off based on these intersectional identities around sexuality, ethnicity, but also disability. And these girls are just the most amazing, I would say, advocates that I have seen in a long time. I do feel like we're living in a generation where people are centering these intersectional issues in ways that many of us, particularly for my generation, had never thought about, and how they activate around the issue, and how sensitive and intentional about centering these issues, I think has been especially a pleasure to watch. And their growing expertise around how we open a voice and space for various more marginalized voices that we haven't heard before. And so Mefali is just one of those groups that that Global Fund for Women supports, but there are many that have actually grown up in this pandemic, even though it's only been 2+ years, but found necessity around this issue. You're going to see a lot more, I think, voices being heard and a lot more opportunities for them to organize and to really help all of us understand how to support them.
Thank you, Latanya, and thank you so much for that question. It's an important part of talking about gender. We have just gotten our 5-minute notice, so I'm going to invite each panelist to share a last parting thought, perhaps a piece of hope, a wish for the future, or something that they hope that you'll leave the room or this session with. Let's start with you, Lisa.
Okay, thanks. Well, thank you all. This has been such a pleasure, and it's gone by so quickly. So let me just offer a few parting thoughts. So as I mentioned, well-designed, gender-responsive fiscal policies are crucial, I think, for encouraging and supporting economic growth going forward. But I'd like to emphasize, too, based on what the panelists have also said, the importance of these policies being underpinned by increased data collection and analysis that can also help support transparency, too. And one more thing that I'd like to add is the importance of breaking down discrimination and social barriers, social norms that limit women's opportunities and chances for economic empowerment. These cultural barriers and social norms that are in place, we've seen time and time again through our studies how much they end up impacting economic growth. And so taking fiscal policies, but then also working to break down these barriers through our own roles as citizens, as advocates, as researchers, can help go a long way in improving the future and improving the speed at which we can finally achieve gender equality. So I'll leave it at that, but thank you again.
Gender equality being the goal. Let's do this. Shirley, let's hear from you in your last minute.
Thank you. I would say that throughout these conversations, what I also have been able to reflect on is that, well, we know that there is there's still inequality in gender, but we also know that there is no one-size-fits-all solution, that these solutions have to be thought out quite well, and that we need to increase collaboration and partnership to advance those. That it's difficult for one single group to make a dent in these very complex issues, but if we all work together and that if we are enabling each other to give the best of one of us, that we're able to really at least make improvements in this problem. And lastly, I just want to emphasize, and I'm glad that Lisa, mentioned about the data, and I think this is very critical. It is very critical. We talk, the person who just asked the question about gender, we have to be purposeful when we design our studies, that we have that in mind, that we have the responsibility to ensure that the data is well disaggregated so we can make informed decisions, or the reader can make informed decisions for policies. And not just in sex, because, sex is also binary, but gender, there's a spectrum of gender, that we really need to be purposeful in acquiring and analyzing data by gender, because that's the only way that we can really advance policies. Thank you so much. This has been such a pleasure.
Thank you. And Shirley, you've got a platform to do more data analysis for us through the J&J programs. That's fantastic. Helga, what would you like us to go away thinking about?
Yeah, I think the most important thing is to make it explicit. Women, girls need to be, it can't be only, we can't just use equity, we just need to also embed that kind of being explicit about it. I think we need to include women into the planning. And so that we hear from them and really ensure that women and adolescents not only have a seat at the table, but they also have a voice in that. I think it has to be a cross-sectoral. It cannot be only health, it needs to be really in different sectors. And then I totally agree with that. The data has to be clear, and enough investments in data have to be there.
Fantastic. Thank you. Let's invest. We need it for the future. Latanya, what are your last words for us here?
Thank you. And I'm going to try to pull this together in ways because it's been so great listening to all of our colleagues here. I just want us to remember as we leave here, some of the countries that did the best around COVID response were countries led by women. And I feel like we just have to kind of get that out there in this session because it really mattered who was in the leadership chairs when it came to the COVID response. And so in addition to that, I also want us to just remember that COVID didn't happen just in a vacuum, that we are living in a time of multiple crises. Even before COVID, we're experiencing a climate crisis, and we're actually getting to a point where we pretty much are going to have to take pandemic type measures if we want to address this problem. And so when you do have so many intersecting crises that we are going to have to support community groups. We're going to have to support women who, in my world, I call it feminist leadership within communities. And so you'll see this thread from who's in the leader seat in the countries to who's in the leader seat in the communities. And I think being able to do that means that what we see, these rising gender justice movements that are really focused on social returns are getting very little money, very, very little funding, despite all of the information that says that these movements are what makes a sustainable difference in the world. And so I think we have to really focus on making sure that they get the kind of funding they need to get the data, to mobilize the people, to organize and to make and get policies and structures and systems that work. Now, I'll just end with that love quote that I hope we all know from Margaret Mead, which is that never doubt that a small group of thoughtful, committed citizens can change the world, because in fact, it's the only thing that ever has. And so I thank you again for the opportunity to be here with all of you.
Oh, perfect, Latanya. That's such a great note to end on. So we'll leave it there. This is a room and a botanical garden full of committed citizens who together will change the world. So thank you to Texas Biomedical, to the Botanical Garden for hosting us, and to all of the folks here who have made our text seamless. You all look marvelous on the big screen, actually. And everyone who's joined us here and from afar, it's been a delight. Thank you so much.